Thank you, Mr. President. I rise to talk tonight about one issue. The issue is children in the context, two separate contexts. One is the budget that we're debating now, we'll continue to vote on all week, and then the second is with regard to the children's health insurance program. Let me just start with a premise that those of us who are elected in both houses of the Congress and in both parties, I think are charged with a basic responsibility to our children. It doesn't matter where we live or what state we represent or what district in the case of the House. I think we're charged with that responsibility. A long time ago, Hubert Humphrey, who served in this chamber for so many years and was so well known across the country, set forth a moral test of government. He talked about the moral test is how government treats those in the dawn of life, those in the shadows of life, and those in the twilight of life. Of course, when we're talking about the dawn of life, we're talking about children. And I think that test is still appropriate and should be we should try our best to adhere to it in terms of public policy, and especially when it comes to the budget. The budget, of course, is a reflection of who we are as a country, what our values are. It's, in a sense, a mirror into which we look, or should be looking, to see who we are. And if we're not setting forth policy and being strong advocates for our children, we may as well not be here. So I think there is a test that each one of us must face when it comes to what we're doing on behalf of children. I also believe in a very real sense that the programs, the strategies, the expenditures that we make on behalf of children are in fact an investment in the long-term economy of the United States. This isn't just the right thing to do, it's also the best thing we could do for a growing economy, for our fiscal situation years from now. If kids are healthier, they'll get better jobs. If they learn more when they're younger, they're going to earn more when they're older. That's not just a rhyme, it's true, and all the studies show it. So I believe this budget debate is a time to reflect upon what will happen to our children. I have real concerns about the budget as it relates to children. And again, these are, in our society, the folks that are powerless and in many cases voiceless. They're not voting. They don't have a lobbyist. They don't have a high-paid strategist or voice for their needs. Because they are powerless and because they are, in a sense, voiceless, it's up to us to speak on their behalf. And we speak with our votes. We speak with our work. So what are we doing in this? What's the proposal in this budget? Let me just walk through some of the numbers. According to one of the leading advocacy organizations in the United States, First Focus, discretionary investments make up nearly 1/3 of all federal investments that go to children. So what we do on the discretionary part of the budget, which by definition, because it is discretionary, we have decisions to make about it year after year. Because of that, we've got to be very careful when it comes to these decisions, whether it's the budget resolution, whether it's the authorization process, or whether it's, in fact, of course, the appropriations process. This funding, the so-called discretionary, non-mandatory, if I can call it that, part of the budget, includes programs like Head Start, child care assistance, housing supports, special education, just to name a few examples that have a direct and substantial impact upon our children. The Republican budget that we're debating this week cuts $236 billion over 10 years in the non-defense discretionary part of the budget. Non-defense discretionary is a long way of saying the part of the budget that we vote on and we'll have votes on that relate to the appropriations. So $236 billion over 10 years is the cut. That cut, I would argue, falls disproportionately in a substantial way upon children. So what do these cuts mean for children and for families? And of course, you can't separate one from the other. We'll look at Head Start. 35,000 children would be cut from Head Start, some 1,250 fewer children in a state like Pennsylvania, just by example for one state. What are we going to gain? How better off will the country be with 35,000 fewer kids in Head Start? I don't think we're going to be better off. I think we're worse off if we do that. And it makes no sense. This is a program that has been in existence for 50 years. It's helped a lot of children succeed. Our state director, the state director for my office in Pennsylvania, just left our staff recently, but served with distinction. Ed Williams, his name is. He was a Head Start kid. I meet people all the time in our state who are leading very successful lives in the private sector or the public sector. Ed is just one example. After having the benefit of Head Start, to get early learning, to get a head start in life because of disadvantages that certain children face. How about students with disabilities? A $347 million cut to funding for students with disabilities, which means a little more than $12 million less for Pennsylvania children with disabilities. How about housing? 133,000 nationwide, 133,000 fewer housing vouchers. So in Pennsylvania, that adds up to 620 families that would be able to, if they had those vouchers, would be able to afford decent and safe housing. What are we getting for that? What are we getting for fewer families that have access to housing vouchers? Again, not an experimental program, a program that we know works, a program that's been in existence for a long time to help folks. We know that when we invest early in a child's life, we see a great return on investment. All the studies show this. It's irrefutable. You spend $1, you get a lot more than $1 back. By some estimates, the bang for the buck is in the double figures. In one study, spend $1 on early learning, get $17 back for the $1 that you spent. I mentioned before that if we make investments in children in terms of their early learning, they will in fact learn more now and earn more later. That's what we should be focused on when it comes to our children, when it comes to their ability to succeed in school, and of course, when it comes to their ability to get a good job and to be part of a growing economy. The budget proposal makes deep cuts in many other investments that protect our most vulnerable children, including the Supplemental Nutrition Assistance Program, so-called SNAP program, which we used to call food stamps. That, of course, provides nutrition aid. If we were doing the right thing as a nation, and we're not there yet, even though we've made some progress on some fronts, we would make sure that children have enough to eat. That would be one pillar of our protections for children. We're not there yet, but the SNAP program helps substantially on that. We would make sure they have early learning opportunities. I've talked about that, we'll talk about it more. We would make sure that they have access to health care. That's why we have Medicaid for poor children. That's why we have the Children's Health Insurance Program for others. And that's why so many private sector companies provide health care that, of course, covers children of their employees. But if we're doing at least those three things, early learning, food security or food and nutrition, as well as health care, we're going to be doing what's right for our children. So we have to examine this budget, I would argue, and apply a kids test, not a special interest test, not a lobbyist test, not a who is powerful test, not a test about who has the most to gain from this budget, but who might have the most to lose. And one of those groups, I would argue, are our children. When it comes to the SNAP program, according to Feeding America, another great advocacy group, nearly half of all SNAP participants are children. And according to another organization we rely upon for analysis, Center on Budget and Policy Priorities, investments in SNAP lifted 2.1 million children out of poverty in 2013. So why would we cut a program like that would disproportionately and adversely impact our children? What do we gain for that as a country? What do we gain when fewer and fewer children are helped with a nutrition program that will make sure that they have enough to eat? In addition to SNAP, the Republican budget would roll back significant progress we've made for children who qualify for the child tax credit or the earned income tax credit. If the improvements to these credits are allowed to lapse, the Center on Budget and Policy Priorities estimate that 1 million children will fall back into poverty. I think people in both parties would argue that these two, and maybe especially the earned income tax credit, are one of the best, some would argue the best poverty reduction strategies that we've ever had in place in our law, in our policy. So I think if the earned income tax credit is keeping children out of poverty, we should make sure that it remains in place and remains a program that, or a tax strategy that can help prevent 1 million children from falling back into poverty. We should also be using the tax code to help working families rise into the middle class. Those families who may not be there yet, but can rise into the middle class. But instead, the Republican budget does nothing to prevent tax increases averaging $1,100 for 12 million families and students paying for college, and $9,000 for 16 million working families with children. That makes no sense for those families and for those children. As many as 486,000 Pennsylvania families could benefit from the Earned Income Tax Credit, the Child Tax Credit, and the Opportunity Tax Credit in 2015. All good ideas, all impacted adversely by the budget. Finally, I'll conclude with Medicaid. Medicaid for some people is some program far away that they don't think affects their lives. Well, a lot of families, lower income families, middle class families even, benefit from the long-term care part of Medicaid. A lot of families out there may not know that Medicaid is the reason that their mother or father or loved one could be in a nursing home. What does it mean for kids? Well, Medicaid for so many children, millions of them, is the only health care that they have. The good news is that it's very good health care for a lot of children. They get access to early periodic screening and diagnostic testing, so they get the screening and the testing they need so that we can provide the kind of health care that child needs, that you cannot provide unless you do that screening for those children. It provides quality health care for millions of children in the country. We should remember that when people make proposals around here to slash Medicaid. Some by hundreds of billions of dollars over the next decade. That's a direct hit on children. Based on calculations from the White House, the Republican budget proposal would block grant Medicaid funding to Pennsylvania by more than $41 billion over 10 years. I don't know how the Commonwealth of Pennsylvania or any state is going to be better off when Medicaid is block granted, sent back to the states, just hoping that maybe the states can pick up the cost. That makes no sense. Our state is going to be worse off if we lose $40 billion or even a number lower than that over the next 10 years on Medicaid. 47%, by one estimate last fall, 47% of rural children who live in rural areas, are the beneficiaries of either Medicaid or the Children's Health Insurance Program. So when those folks talk about cutting Medicaid or not doing what I hope we can do, which is to extend the Children's Health Insurance Program for the next 4 years, not only 2, they should remember that 47% of rural children benefit from those programs. Children, when it comes to Medicaid, may only make up 20% of the costs of Medicaid, but half of the enrollees in Medicaid are children. So they might only be 20% of the cost, but they're half of the enrollees. We know that Medicaid was created 50 years ago. The government put forth a promise, which is similar to the test I started with about children in the dawn of their life. The promise was to ensure that the most vulnerable members of society had access to health care. Pretty simple promise, and pretty easy to understand our obligation when we recite that promise. So whether it's our kids or whether it's older Americans who need to get nursing home care, or whether it's Americans, and many of them children with disabilities, Medicaid ensures that access to health care. Medicaid is the promise that we must keep to folks who need nursing home care, to children who are poor and will not have health insurance without Medicaid, and of course to individuals with disabilities. So we've got a long way to go to prove that we're keeping that promise. Mr. President, I'll conclude just with some thoughts about the Children's Health Insurance Program. We all know that this is not only a bipartisan program, but a very successful program. From 1997, when it was enacted, to the year 2012, the uninsured rate for children fell by half, from 14% to 7% across the country. A remarkable achievement. It means we're not there yet, because we still have 7% uninsured. But that is a substantial step forward, a substantial measure of progress for the country. This program, the Children's Health Insurance Program, along with Medicaid, is helping to reduce disparities in health coverage affecting low-income children across the country. Without legislative action to extend funding beyond September 30th of this year, over 10 million children across America are at risk of losing their comprehensive, affordable, let me say that again, comprehensive and affordable quality care, including, by one estimate, 270,000 children in Pennsylvania. About 2 million of the children currently enrolled in CHIP would likely end up uninsured, while the others would face higher premiums and higher out-of-pocket costs. So we should do the right thing and make sure that we have funding in place for 4 years for the Children's Health Insurance Program, not just 2. Unfortunately, what we're hearing from the proposal sent to us by the House is that 4-year commitment is only 2 years. So we have a lot of work to do, and I believe the right thing to do on CHIP is to enact what Senate Democrats have proposed, a 4-year so-called clean extension of the Children's Health Insurance Program as soon as possible. That's Senate Bill 522. That would be the right thing to do. So we can give speeches and talk a lot about how we all support kids, and that's nice to say that, and it's nice to vote once in a while for programs and strategies that help kids. But I believe the test is a lot tougher than that. The test will come on this budget vote, a test whether or not we support children. And if we're cutting Medicaid by hundreds of billions of dollars over the next 10 years, and if we're cutting the SNAP program by tens of billions of dollars or more, maybe even higher than that over the next 10 years, and if we're not doing the right thing on children's health insurance, and I could go down a longer list, then we're not doing what we need to do for children. The folks that don't have lobbyists, they don't give campaign contributions, they don't have power, and they may be voiceless, but we have an obligation in both parties and in both houses to be their voice. But I'm afraid we're headed down a road with this budget that harms children substantially. And I hope that we, in the next couple days, make the right decisions for our children. Mr. President, with that, I yield the floor.